Hello, ladies and gentlemen. Welcome back to the Royal King TV. My name is Ajambi. You can always call me the Royal King. Please, I entreat you to subscribe to the Royal King TV. When you finish, you look down there, you click on the notification button, then you share so that others will also benefit from this very education. Knowledge, they say, is power, but shared knowledge is far more powerful. If you have any question on kidney disease, please, this is the very episode for you. Please spare me about 8 minutes of your time to listen to this very education. Without wasting my time, let's go over to the studio to listen to PSA Dr. Augustus K. Iduafo.
Michelle.
Yes. Thank you so much, Doctor, for the presentation. I just have two questions. My first question is, what type of dialysis treatment is recommended for young people? And my second question is, if your kidney is damaged from an autoimmune disease such as lupus, as you talked about, but you get a new kidney, is there any chance that this new kidney will be damaged by the lupus again? Those are my two questions.
Very good, nice question. Let me answer the second one first before I go to the dialysis. Interestingly, lupus nephritis, lupus patients who develop kidney disease, when they get a transplant, the recurrence of the lupus in the transplant case is very, very rare. The recurrence rate is 0.05%. The same way goes to even diabetics who lose their kidney and they get a kidney transplant from cadaver from somewhere. For whatever reason, the diabetes doesn't come back to destroy the kidney. I think it's some genetics, but yes, lupus patient, when they get transplanted, it's all good. I have a lupus patient who have been transplanted for 20 years. And he was 19 when we transplanted and is now 39, looking good. So you are right. So that's your answer to your question. For dialysis, if you say young, normally young people who are students or going to college or high school, we actually recommend peritoneal dialysis because you do it at home. Now, peritoneal dialysis can be done only at night. You don't have to do it during the day. So they'll bring a portable machine to your home, and then when you sleep at the night, you connect yourself to the machine with all those solutions on top. Maybe from 10 p.m. to 6 a.m. By the time you wake up, the dialysis is done. It's called continuous cycler peritoneal dialysis. So that during the daytime, the person can go to school and do. I have 3 patients who go to community college, one go to law school here who are doing that. I put them. Like hemodialysis 3 times a week is tough. Okay, because when they do it, at times after the treatment, you feel so weak and the conditions, you can't even walk for a few hours. And that's not a good one for individuals, young people who want to go back to school and work. So that's the thing. And in fact, in young kids, it's always a good idea to do peritoneal dialysis where the parents will do it for the kid, so that you can save the arms for future hemodialysis. So that's the answer to the second question.
Thank you.
All right, Richard Apple.
All right, hi, Doc.
Yeah, Richard.
Hi, how are you?
Not too bad.
Yeah, thank you so much for the presentation. My question is, I've noticed that of recent time, there's been a strong push in Ghana for non-traditional medicine. The use of herbs and other things. Now, some of those treatments that they do prescribe, I'm not so much sure how they arrive at before they prescribe those treatments. What can you say about it?
Yeah, it's in a country where about 70% live in the rural areas, they don't have access to good medical care. It's very difficult to put rules and regulations that prevent people from doing their job. To be honest with you, all medications, all tablets, they all come from herbs. The only problem is that how much you have to take to fix the problem. But I personally know some herbs that when you drink can ease off your asthma. Okay, I know that. Well, growing up as a kid. But do you have to drink 4 calabashes of that to do the same trick? Or maybe they can refine what is in it and give it to you. That is what the Center for Plant Research in Mampong and Kumasi is supposed to be doing. So my only feeling is that for them to allow the medicine to come to the market, I assume they've done all this research, they know what they do. But to make a herb which is panacea for everything from infertility to brain tumor, that is tough to take. But there's a good thing among the herbs if they can be found in the right proportions, devoid of impurities, and given it properly. I also say this: we cannot in Ghana disregard the pastors when healthcare delivery is important. You know, everybody goes to church, they trust their pastors. So it is the responsibility of the healthcare professionals to engage the churches so that they can incorporate into their sermons on a weekly basis the importance of good health, good nutrition, and taking care of and taking sick medical help. That's not to say that when you have headache, they pray for you, you go. No, these pastors should know. They should be told that they may be the first line of contact, so that we expect them to send them to the hospital. And also the big churches can do every quarter health seminar where they have nurses and doctors among them. They can check the congregants, blood pressure and stuff like that. Now there are automatic tests for high cholesterol. They can do all those things, and maybe twice a year, and they can pick up those who have problems and then give them a referral to see patients, see doctors. Because we cannot say that, oh, the pastor don't do a good job. No, you can't do that. We have to engage them to do the right, incorporate into their sermon. Can you imagine if Action Church guy had 5 minutes of a Sunday sermon, tell them the consequences of hypertension and stuff? I'm telling you, people listen to them more than even doctors. That's what I would say. But you are right about the herbs. They are good. I don't know how much one has to take to fix the problem. And of course, all these medications, because when a medicine is being approved, it goes through a series of evaluation. Phase 1, phase 2, phase 3. Phase 1 to make sure that it actually works, and phase 2 make sure that it doesn't have any side effects and in animals. Then phase 3 means that it will be good in human. Have they done that for this herbs? I don't know.
Thank you so much, Doctor. I don't see any hands here. Let me see. Did anyone put any question in the chat? If the person did, you can talk.
Can I come in for a second?
Yes, please.
Fanta.
We're gonna Justice, we're gonna take about 2 or 3 more questions, then we'll wrap up. Time is fast spent, so go ahead.
Yeah, I'm going to have a question too.
Fanta, this is Joe Fosu, Professor Fosu.
Okay.
Thank you for that excellent job with a lot of information that you were able to pack within 1 hour. Thank you, and I enjoy listening to. And hello to everybody. Most of you we haven't met, but I wanted to say something. Two things, and I'll also talk about in a split second the elephant in the room. Every medication has a good effect and either an adverse effect or side effect. It depends on how you use it, how much you take, how often you use it, how long you take it. So the idea that he said 1 or 2 medication can cause that doesn't mean that if you are on that medication, you stop. You need to work with your physician to see whether it's working for you or it's not. The next thing I call the elephant in the room, most of my brothers and sisters may not pay attention enough to their health issues or health care. I have seen it over so much long time, either in Connecticut or in Washington, D.C. area. So my advice is, as you prepare for all the things that we do, we buy clothing, we shop for all kinds of things, we have parties or whatever. I have a number of friends that to the extent that they buy so much that when you visit their places where they live, you wonder all the things that they are buying, what is it for? My advice is that at least budget $250 or somewhere around that number and go once a year to a physician for a health assessment. Just do that. And when you do that, at least from age 40 or 45 and above, once every year, just budget that. And if you go and you are okay, you are okay. If you are not, then we can do a lot of things to hopefully prevent or mitigate or see how we can help you. There are most of us that we spend the money on other things and we forget about our own selves. So my advice is that make sure that your health comes first. So this is very important to some of us who are in the health profession. We see it, we try to help, but by the time you begin to help somebody, they're already far down the line. Thank you very much. I know this might not be what you wanted to hear, but some of us have seen it so much that we need to begin to make some noise about that. Thank you.
Thank you, Prof, for your information. Professor Su is a professor of pharmacy, so he's an authority on medication. And to make his point strong, I take omeprazole. Okay, I know that it can cause chronic kidney disease, but listen, I have acid reflux. If you don't take medicine for acid reflux, you know what is going to happen to you? You develop adenocarcinoma of the esophagus and the stomach cancer. I'd rather get a kidney disease and get a dialysis than get a cancer. Period. So I take it. And it's not everybody who develop a side effect, like Prof said. So if it's a side effect, they will evaluate you and change it for something new. So thank you, Prof, for the comment.
Dr. Juliana.
Thank you, Doc, for the nice presentation. Dr. This is Juliana Kwachu from Ghana. I wanted to find out whether, from percentage-wise, peritoneal dialysis is as effective as hemodialysis.
Oh, yes. Peritoneal dialysis and hemodialysis, there's no difference in terms of the mortality of the patient. It's very, very effective. It's just like peritoneal dialysis is a little bit more labor intensive because you're gonna have to do it at home, and the person has to live in a very clean environment. You cannot have pets in your house, and so forth. And you have to be a clean person because you can get infection. But otherwise, you do it 4 exchanges during the day or the cycle at night. You can live as long as. The interesting thing is that, people don't want to stop urinating. When you are on hemodialysis for 6 months, the urine stops. You won't pee anymore. People don't like it. Can you imagine a woman who's already in menopause, who doesn't make any menses and doesn't make urine? She doesn't feel like a human being anymore. Peritoneal dialysis affords you the opportunity to continue to urinate for even 2, 3, 4 years. It's very good. If I lose my kidney, that's what I would do. Okay, so, but unfortunately, we don't have it in Ghana, which we are trying to push to make it cheaper for dialysis. So yeah, it is very effective and it has the same outcome as hemodialysis.
Thank you. Felix? Jay?
Hi, yeah, I'm right here. Hey, thank you, Doc, for the presentation. I have a question, though. So one of the causes for the chronic kidney disease that you highlighted was obstruction in the bladder. So if you have that obstruction in the bladder, and let's say you get a kidney transplant, how good, what's the lifespan? How long can that new kidney function with that the obstruction still in the bladder?
So listen, you can't get, okay, let me put it this way. Obstruction that I talked about, the most common cause is a large prostate. Okay? You cannot keep a prostate in place with obstruction and give somebody a transplant, because the same thing is going to happen. Because urine is not going to come out and it's going to block the transplant kidney and destroy it. So they have to fix the underlying problem, obstruction. Obstruction is there. But the interesting thing is people with the bladder cancer, who have bladder cancer, they can remove the bladder from the body and create a new bladder using your intestines, and then you can get a transplant, which will make you urinate into that new bladder created for you. So that is doable. But yes, the obstruction needs to be relieved. If you can't relieve the obstruction, there's not going to be any transplant, period. And by the way, for you to get a transplant, you have to get a very good heart. The heart should be pumping better than 30%. Anything that heart pumps on the 30%, you can't get a kidney because you're not going to produce enough blood flow to the kidney. So there are several do's and don'ts with regard to transplant, which we are trying to establish in Ghana so that we can get most of our people transplant.
Oh, okay. All right. Thank you. And
all right. Thank you. Preggy, is it Preggy? Can you go ahead, please? Because of time, we're trying to cut these questions. If you ask your question, to put your hands down. Okay, sure. Go ahead.
Can you hear me?
Yes.
Okay, I'll make it pretty short. I asked a question about the PSA. Is it something that is required to be ordered during the routine checkup for men after 40, or something that a person needs to request from their PCP?
Oh yeah, actually, it is not a routine. Most doctors, you probably have to request it, but if most primary care doctors will get a kidney function test, liver profile, urine, PSA 40. Most of the primary doctors I know add it to the armamentarium. So it's good to do that. But you can also request it. You can tell the doctor that, hey, I'm being, but certainly if you have symptoms of nocturia, having more urine output in the night and difficulty in initiating and all that stuff, that is even a good reason to request it. But most doctors will request it. And insurance company pays for it.
Okay. Nana Danso.
What's going on? They can't hear me. Can anyone hear me?
Yes,
we can.
Okay. Hey, Fanta, this is Clemo. How's it going?
No, not too bad. Not too bad.
Good. Hey, that's an excellent presentation. Thank you for that. But I did ask a question about the PSA right after the first guy asked, which is it really predictive of what do you call it? Kidney cancer? And secondly,
Kidney.
What is, if you interact with our folks back home at Kolebu, whether or not there's enough education even for the professionals. The reason I asked this is because there was one time I was on a forum and I was, educating some folks on there about kidney disease and the effect of this herbal medicine on them. And there was one professional on there who got very offended. He's a PharmD that, I live in a good country and I'm disparaging local medicine. I told him that's not the case, for the reason that we don't really have a standardization of all the medications that people take back home. And I just wondering what, if anything, you guys are doing with education, even the professionals back home, about herbal medicine.
Yeah, I tell you what, maybe Professor Su can help me out here. He's a professor of pharmacy. I have a friend who deals with this herbal medicine, and anytime we have an argument, he's so upset. So I said, no, I personally, based on what I told you, I don't disagree. But I as I said, I know an asthma medicine that you can drink, the calabash, the asthma will go away. The question is, how many calabashes do you have to bring together, taking care of, if it can be done? But education is the key. I think we need to find a way. We can go and trash them. That is given. We can't try them, but we have to work slowly with them, trying to. And the same way goes with the pastors. I told you, you can't trash them. When they see the people every Sunday, they can work with you and them and can get this right direction. Come on, you're right. But you see, the purpose of most of the people in Ghana, they are not comfortable. The moment you start speaking, they think you are coming to try them, and it's not. I guess it is the attitude, the way we were brought up over there, that makes it bad. Even when somebody is not doing well and you call for me as a physician, you want to talk to somebody, they don't want to talk to you.
Right.
But they don't want to talk to you. I mean, but nobody knows everything. I don't sit here and manage patients in Ghana, but I'll give you an idea of what you can do to try and figure out what you are doing. You know, so that's I sit here, I manage 12 patients who have had a kidney transplant living in Ghana. They send me the labs every month. I go over and do Zoom with them. I manage them. I've been managing them for the last 5-6 years. No problem. So it's a matter of just being proactive and being nice to them and trying to, you know, but the bottom line is that we want our people to be healthy.
Yeah.
Yeah.
It's a picture.
Thank you so much, Doc.
Thank you very much for your time. I believe you've benefited from this very episode. And I still entreat you that if you've not subscribed yet and today happens to be the first time you are watching us, be part of the family. Subscribe to the Royal King TV. When you finish, you look down there, you click on the notification button, there you share so that others will also benefit. Don't sit on it. Please share. It's going to be beneficial to mankind. Until we meet again another time, I say enjoy the rest of your week and bye-bye.